Dubai Health Authority, Prometric exam questions for nurses. For complete study materials and other assistance, contact Nursing Mantra through WhatsApp on 9715025151717. Question number 1. The nurse is caring for a 60-year-old in the medical surgical unit. On entering the room, the nurse finds the patient alert, oriented, and the skin color appears healthy and pink. The nurse observes electrocardiogram and notices absent P waves. Which initial action is the most important? A. Defibrillate. B. Cardioversion. C. Pacemaker preparation. D. Intravenous amiodarone. The answer is D. Intravenous amiodarone. Question number 2. During health education for a patient on monoamine oxidase inhibitor, the nurse instructs him to avoid certain foods that can interact with the MOI. Food containing which of the following contents should be avoided? A. Alcohol. B. Caffeine. C. Theramine. D. Folic acid. The answer is C. Theramine. Question number 3. After teaching a 54-year-old patient with angina on how to take nitroglycerin sublingual PRN, which of the following statements reflect the patient understanding? A. I have to take this medication once, I need it only. B. It is okay to take 1 tablet daily to prevent the heart attack. C. I can take 2 tablets together at once if the attack is. D. This medication will regulate my heartbeats and I will be. The answer is A. I have to take this medication once, I need it only. For complete study materials and other assistance, contact Nursing Mantra through WhatsApp on 9715025151717.